Hello everyone, my name is Gail, and today we're talking about a recent study investigating gender dysphoria and autism. So gender dysphoria is a clinical term, and it refers to when someone who identifies as transgender or gender diverse experiences persistent emotional distress associated with their gender identity that differs from the sex that was assigned to them at birth. And there has actually been a fair bit of research in recent years around the co-occurrence of autism and identifying as transgender or gender diverse, suggesting that there are elevated rates of in clinical samples of people who present at gender identity clinics for elevated rates of autism diagnoses, and that gender diversity is reportedly higher in self-reported samples for individuals who are autistic. But a lot of this research has been done in these sort of more clinical samples or in surveys or online, and there's some questions about, I guess, the representativeness or the generalizability of some of this data. So the study that we're linking to you today is a really large sample, a large pediatric cohort from the United States of more than 900,000 adolescents aged between around 9 to 18 years of age. Of that 900,000 or so, 40,000 were identified with an autism diagnosis from their medical records. So in those children who were diagnosed with autism, around 1% had information in their medical records to confirm that they had a gender dysphoria diagnosis as well. And this is around 3 times higher than for those individuals who were not identified as autistic as well. This is actually a bit lower than has been reported in previous research, but still much higher than in children not diagnosed with autism. And for those with an autism diagnosis, those assigned female at birth were actually more likely to have a gender dysphoria diagnosis than those who were assigned male at birth. So these are really important and interesting findings. They have really significant clinical implications for those individuals who do work clinically to support children and adolescents on the autism spectrum. And it really emphasizes the importance of providing developmentally responsive and affirming care that aligns with the young person's preferences and their strengths. They also highlight the need for us to understand and affirm a young autistic person's gender identity. There is really significant research that emphasizes that having a positive support from everyone around you, from your family, friends, and the health professionals who support you, really does lead to better mental health outcomes for young people. Now, there's some really interesting resources that we're going to provide to you, led by research here at the Telethon Kids Institute, and we're going to link to you in the video description around autism and gender identity.